Hi, my name is Chelsea, and today I'm going to be performing the central line dressing change. I don't have any nail polish or jewelry, no watches, bracelets. I have my hair up, I have my scrub top on, and I have my student ID badge. So now what I'm going to do is I'm going to enter the patient's room, and I'm going to close the door behind me, and I'm going to perform hand hygiene. After I do that, I'm just going to introduce myself to the patient, do my 2 patient identifiers, first and last name and date of birth. After I've done that, I'm going to go ahead and place a mask on and place a mask on my patient as well, and I'm just going to simulate that. Now that I've taken care of that, I'm going to go ahead and perform hand hygiene again. I'm going to go ahead and put on my clean gloves here. I'm going to use my non-dominant hand to stabilize the catheter or tubing here, and I'm going to get each corner and just lift it up, and I'm going to peel away and make sure that I'm staying parallel to the skin. This also prevents from possibly dislodging the catheter, so I'm going to go ahead and peel away. We're going to throw that in the trash, and now I'm going to inspect the insertion site, the surrounding skin, and also the catheter. So with the catheter, I just want to make sure that it's not dislodged, that it is intact, and I do see that here. I'm also checking for the surrounding site for redness, tenderness, swelling, or a rash, and then also I'm checking the skin integrity as well. And like I mentioned, everything looks good, and we just want to ensure that we don't see any abnormalities or signs of infection for all 3 of those. So I'm going to go ahead and remove my clean gloves, and we're going to move on to the sterile portion. So I'm going to throw that in the trash. Once again, we're going to perform hand hygiene. All right, perfect. And now I have my central line dressing kit right here. I'm going to peel away, pinch it down so it doesn't come back up. And I'm going to grab my sterile gloves here. I'm going to open it up, pinch the 1-inch margin. And I'm going to take my non-dominant hand and a pinch right here. Then I'm going to go and scoop it up on the cuff here. All right, perfect. So now what I'm going to do is I'm going to grab the gauze, and I'm also going to grab the chlorhexidine, and we do want to make sure that we hear a crack, and I'm going to simulate that. We want to ensure that the sponge is fully saturated. I also wanted to mention that I do need to make sure that I stay above my waist so that I don't break sterility. So I'm going to go ahead, use the gauze to pinch right here at the tubing, and we have to clean or cleanse the site for at least 30 seconds. And we want to make sure that we cover the entire size of the dressing. So I'm going to go ahead and start counting. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then we're going to clean underneath the tubing and clean on top so that when we place it down, it's still within a sterile field. And then we're going to go ahead and we're going to throw that in the trash. And then now we're going to move forward to placing the dressing. So just going to peel this, and I wanted to mention it's super important to ensure that we wait 30 seconds for it to dry and I'm simulating this, that it's been the 30 seconds and that it is dry. I'm gonna place this down on the site. We wanna ensure that there's no wrinkles. And I'm going to simulate peeling off this entire portion for remediation purposes. So I'm gonna act as if I peeled off the whole thing, and I'm going to initial and date and gauge. And it's very important to do it on the side of the insertion site, not too close, because we want to be able to monitor if there is any drainage or if they do have a reaction. So I'm going to put it on the side there. And now everything looks good, so I'm going to go ahead and clean up everything. So I'm going to grab all my soiled supplies. We're gonna throw it in the trash. I'm gonna go ahead and remove my gloves. Throw it in the trash. I'm gonna perform hand hygiene. And I'm gonna remove the patient's mask. And then I'm gonna also remove my mask as well. Make sure I discard that. And I'm just gonna perform hand hygiene again. And I can follow up with the patient with any questions or concerns if they did have any. And if they don't, then I would exit the room and document everything. Thank you.